This is Dr. Joshua Katz, and I'm here with Dr.
Ellen Lottie.
And this is another episode of Gray Matters. Today we're going to be talking about biotin.
We've been hearing from patients in the office about a recent clinical trial looking at biotin and its use in progressive multiple sclerosis. And because of that, we've decided to address that here in our podcast.
So I thought it would be interesting to approach this from two perspectives. If I were a patient with progressive MS, would I want to take it or not? And then the other perspective is, as a physician, would I want to recommend it to patients? Because I think those two things are different approaches.
They're interesting and they're related, but I think we should first start with the facts about what we know about biotin and what's been published or will be published about real data, and then we can come to the opinion part of it, because it's hard, I think, for patients to have an opinion without having some information. I think it's hard for us to have an opinion.
So I guess the first question is, what is biotin? And you don't have to answer that question because we're going to do an outtake, and one of us is going to read what biotin is. Do you want to do it or do you want me to do it?
I can do it right now. Biotin is a B vitamin, B7.
How come they call it vitamin H when I've looked at it?
Because in the past, it's been said, and it might be a wives' tale, that biotin is useful for strengthening hair and nails, and that's where the vitamin H comes from, the H in hair. Biotin, as a vitamin, has a role in energy metabolism and fatty acid synthesis, and I think that's how it came around to be studied in multiple sclerosis.
A recent paper published which seems to indicate that it might be effective. So one theory is that in progressive disease you have demyelinated axons, and their metabolic demands are higher than a normal axon, and that leads to this idea of relative ischemia, meaning that you have nerve cells that, even though they're functioning at a normal level, they're not meeting their metabolic demands, and that puts them under stress, and cells that are under stress can eventually die.
And that is a lovely hypothesis. We're not sure if that's correct or not, but it's a nice way of thinking about it. So we've heard a lot of buzz from patients, and a lot of questions about should patients with progressive MS be taking biotin. I found it really interesting. I searched biotin on Wikipedia, and there's a paragraph saying that biotin is proved useful in delaying disease progression and affecting disability, and a reference, which is the reference to this single pilot study we're going to be discussing.
The study we're talking about was published in a journal called Multiple Sclerosis and Related Disorders in January 2015. This was a pilot study done in 3 different multiple sclerosis centers in France. They gave biotin in doses between 100 and 300 milligrams per day to 23 patients with either secondary progressive or primary progressive multiple sclerosis. And they gave these patients biotin for somewhere between 2 and 36 months. And then they measured various things to see if they got better. For patients who had walking difficulty, they measured their walking times. For patients who had vision difficulty, they measured their visual acuity, and they had very encouraging results. Of the 4 patients who had chronic vision loss, all of them showed some improvement, and of the 18 patients who had walking difficulty, 16 of them showed improvement. And out of the total 23 patients, 21, which is 91%, showed some kind of improvement, either in their walking, in their vision, or both. So it's a pretty impressive result.
Pretty small number.
Right. But I mean, looking at as a pilot study, I looked at those numbers and I thought, wow, that's incredible, right? 90% of their patients saw some improvement.
Well, I don't know that it's incredible, but it's provocative and it's worth further study.
Well, I'm trying to set things up here, and you're trying to.
I don't know what's in your head.
All right, well, that's okay.
Always.
All right, here comes the criticism, and I hope people aren't too hard on me.
It's not a criticism. Here's the analysis, according to Dr. Katz.
You know what? I'm going to take a little aside just before we get started. I want to tread lightly on this subject. I want to acknowledge that people with progressive disease are very frustrated because we don't have anything to treat them.
Biotin is not the first alternative treatment to have this issue. So whenever something like this comes up, it generates quite a bit of buzz in the MS community. And because we're dealing with a frustrated group of patients where there is no standard treatment, we realize it's natural for people to want to jump to something that may not harm them, but might help them.
My perspective on these things is I like to be very protective of my patients, and I think my biggest worry actually is that people will get taken advantage of.
Either financially or emotionally or based on side effects that aren't yet realized.
Right. So there are a couple of things that stood out to me about this trial right away as red flags. First of all, this was not a placebo-controlled trial. That's red flag number one.
Well, no.
No?
Because these preliminary results prompted 2 phase 3 trials in which there are placebos, a more standard kind of trial. This is just a pilot study.
I guess when I say red flag, I mean, wow, I'm really excited about that result. Hold on a sec. Number 2, and this is only a potential problem, the main author on the trial, Frederick Settle, is the CEO and shareholder of MedDay. MedDay is
I didn't know that.
You did, because I told you he is. So, big conflict of interest.
Well, not unlike pharmaceutical companies doing trials on products they own.
Generally, though, there is not such a direct connection between
Correct.
the physicians running the trials and their profitability.
I have to agree with you.
So that's red flag number 2. Number 3, their definition for progressive disease. They required patients not have a relapse for no more than 6 months.
Relapse? But
Right.
I thought progressive patients don't relapse.
Yes, exactly. That's my point, right? So if somebody had a relapse 7 months ago, they might still be recovering from that relapse for 6 months. You put them on Biotin, and you may see an improvement.
They're looking
in their
better
relapse.
because they're recovering.
Right.
Because we know relapses get better.
And that may also apply to some of the objective measures like visual evoked responses. So it's another potential problem with the study.
And the size.
Oh, that's a big one. 23 patients is a very small number of patients. And it also troubles me a little bit that they had such a robust response, because where do you ever see 90% improvement?
Correct.
90% of people improving. That's such a high number, it actually makes me wonder a little bit.
They also used extremely large doses of biotin. We don't know what a target dose would be, but the amounts sold in the health food stores are measured in micrograms, and this was 100 to 300 milligrams. So we're not sure where that came from either.
Well, I looked this up. I went online and tried to find the maximum dose of biotin you can buy.
What did you find? I did the same.
found 10,000 micrograms. So if you want to take 300 milligrams...
30 of them.
That's 30 tablets a day.
Right. Wouldn't work for me.
It's a lot.
Well, unless I had progressive MS and I was hoping to improve, maybe it would work for me.
The other question is, how much is that going to cost? And it turns out that's actually not terribly expensive. You can get 30 pills a day of biotin. I think it was about $2.50 a day.
And being even more cynical, maybe the CEO of this corporation who was involved in the trial is already manufacturing a higher dose. So small size, conflict of interest with the CEO and the people running the trial. So let's move on to the phase 3 information, very little of which is available.
Most of what I could find was excerpts from the plenary session at the AAN this year.
So the phase 3 data, 16 centers, all in France. As far as I could tell, 160 patients, twice as many biotin as placebo. And this was a controlled trial where degree of disability was measured, and I don't think we know the results, but we'll all be interested to hear the results of a more controlled trial.
The interpretation that I could see is that it looked like there were positive results, but one of the criticisms I saw was that it was relatively weak effect.
What I found is that there was a 67% difference in favor of the biotin.
Well, I'll sort of look at it from 2 perspectives. One is, I'm a patient with progressive disease. There's right now nothing anybody has to offer me, and I'm getting worse month by month. Am I going to want to try this? I would say absolutely, actually. So my perspective as a physician, am I going to recommend this to patients? I would say at this point, based on the pilot study, there's very little you can say that has me convinced that it's effective. There's potential there.
So the real question is, are we dissuading our patients that ask us about it? I guess the answer to that is no. Are we actively recommending that everyone take it? Probably not, but we're willing to have the discussion.
For now, I think that's all we need to say about it, right?
Right.
So we would encourage you to ask about it, ask us about it.
So it might not be ready for prime time, but it's certainly worth following the story.
I think we're going to take a short break, and then we're going to wrap everything up. So we'll be right back, and we're going to finish up the podcast. So one thing that's happened...
We've gone live with our new website, which is elliottlewisms.org. And so we're really pleased with the result. We're also trying to put a lot of fun pictures up.
We put a lot of work into it, and I'm really proud of how it came out.
Just like with our patients, we've taken a very personalized approach to the website development, and see what you think.
All right, so I guess that'll finish this out. So for everybody listening, have a great rest of your summer, and we'll be back hopefully pretty soon. What do you think next time we'll be doing? Who knows? Any ideas?
Who knows?
So we have a couple of things coming up. Your son is getting married.
Yeah, that's not till October.